Good morning. Good morning. It's good to see you all. There are a lot of you. I need to do a little information regarding the tour. I need to make a special request to anyone that has already toured the health center or has been over there to visit or already has a good frame of reference for the health center. Please do not go on the tour today. There are 65 people in here. And we really need to tour the people that have not been. Oh, hey, Lacey. Tour the people that have not been to the health center. We are more than happy to set up additional tours at later dates for folks that need to have or would like to have specific information. I have called April to see if she can send a couple of people over to help as well. But you really can't tour a group more than like 12 or 14 effectively. And we want to be able to answer questions, share information first, and then answer questions. And that would be really important, and I think the most efficient and effective and most thorough way to share and receive information. So if the folks that have done that, I recognize several people that certainly know the health center. We would really appreciate it if you did not join the tour today so that we can try and accommodate the people that in fact have not been in or seen the health center. I hope that's a fair request. I mean that kindly and respectfully, but we want to do a good job. Okay, thank you so much.
Good morning. It's delightful to see a packed house. This is session 6 of 7 of Life at the Forest. For those of you who are new, if you have missed some of the earlier sessions, we begin this series again on April the 15th next year, all over again. We always hope to improve the content from time to time, and we're open to suggestions. This morning, we are lucky to have Leanne Bailey and Karen Henry, who are going to make a presentation. And Leanne is going to talk about the health center and how it works, and Karen's going to talk about how it's paid for by us when we go there, kind of. Okay. Leanne has been here 25 years and has risen through the ranks. And so she is the director of the health center. I can tell you from personal experience, she is a lady who is caring with compassion and will do everything she can to make a resident in the health center and their family as comfortable as possible under whatever the circumstances are. And on the other hand, Karen Henry has only been here 20 years. And Karen came from Hershey, Pennsylvania, in the chocolate business and ended up here, and we still don't understand that yet. Karen is a certified public accountant. She is really accurate with her numbers, and that's important for an organization like this, to have somebody watching the books that knows what they're looking at. So it's my pleasure to say, Leanne, it's all yours.
I like that introduction much better than the bio. Yes, I went to school. Yes, I've been here a long time. Yes, I'm trying to retire. One day we should retire, right? They keep changing the age. So anyway, I just want to thank you for being here. I am a big offender of talking through the slides and never showing you the slides. The slides are really just as a reminder for me. They're not anything fantastic at all, but I can tell you this story easily enough. So, and I usually do it the wrong way. Right. Okay. So I wanted to first talk about our clinic. Our clinic is staffed by a clinic nurse manager as well as a clinic administrative manager. I see that has not been updated. Karen Heath, as many of you have probably met, is our clinic nurse manager. She is an RN. She is going to be here almost a year very soon. Karen is very efficient. Her clinical acumen is exactly what we need in the role that she's in. She responds to many, many of our respond calls, and the triage and the excellence that happens in that is very important to us. And Laurie Locke has been here 32 years, 30 to Lucy tells me 32 years. She was here before the first residents moved in, and she knows way more about everything than I do, and you can ask her any question. What's great about that situation is that our providers really rely on the clinic staff to keep things moving in a daily operational way, the way the Forest expects it to happen. Our providers are the Duke geriatricians from the Division of Aging at Duke. We have been in contract with them since we opened in 1992, and that is a relationship that we're not only very proud of, but we are very appreciative of their service and excellence. They're also their clinical acumen. Dr. Little and I, she's the medical director, we meet once a week, and we discuss any issues that need to be solved. And I will tell you, I speak to my peers and talk with them, and there are very few of them that can pick up the phone and call their medical director and say, hey, can you talk to me for a minute? And they do. I would not have wanted to go through COVID with anybody but Milta Little. She is aware, up to date, and is very, very sensitive to what our living in community means when there are viruses among us. So we appreciate her work with us, and she is very devoted to what happens here, how we keep people safe. And I know many people have said, well, the restrictions are less than than what you're requiring, et cetera, but when you're looking at a community that's living communally, then you are looking at the opportunity to spread infections. So we do take the most stringent restriction allowances. So it's very important if you are concerned that, and please don't just say, oh, I have a cold, or oh, my allergies are bothering me, because 3 days later you're going to find out you have COVID. So it would be very, very important that if you have symptoms like that, you can push your Respond pendant, and this is my commercial on Respond pendants. Hello, everyone that lives at the Forest. Please have your Respond pendant with you. Wear it on your wrist, wear it around your neck. Please do that. It is your connection to a nurse and someone in security that will respond to you on this campus. It is very important. I'm not allowed to say it's required. Know that in my brain I just told you it was required, but I'm not allowed to say that. Please do. It is the most effective way that we can help you right away. You're in your apartment, you're not feeling well. A lot of people get concerned it's for an emergency. It's not just for an emergency. If you're concerned, you have a cold, you don't feel well, you push your Respond pendant, Karen Heath is going to come to you. She's going to assess you, and you're going to learn, she's going to test you for COVID, and you're going to learn whether you have COVID or not, okay? That helps you, that helps your family, and that helps the family you're living with here. Very important. It's not for an emergency, okay? I'm feeling dizzy, I don't feel well, press your pendant. You can't press your pendant if it's in your bedside table and you're down in the bistro. Okay? All right. Enough lecturing about that. I think we're going to hold questions till the end, right? Oh, where are my people? Uh-oh, they left me. We'll hold questions until the end. Are we holding questions to the end, Forrest? Okay, thank you very much. I saw you had a question. So our providers, many of you are new residents here at the Forest. Our providers are open and available to be primary care if you need that. Many people, 80% of the people that moved here are from the Durham, Raleigh, Chapel Hill area and have their own physicians, but I do know we're going through a phase where physicians are retiring. So please know that you contact Laurie in the clinic at 4020 or go by and let her know if you have a need. We do have an urgent care feature to our clinic, and what that means is you cut a bagel and you cut your hand, okay? Press your pendant, and if Karen can't take care of what she needs to see where you're concerned in your apartment, then you can go to the clinic, and Holly, our nurse practitioner, or one of our providers will see you. Holly is on campus 4 days a week, all day long, 8 hours a day, and she is off on Thursdays. Our physicians are here 5 half-days a week, and on Thursdays, they round in the health center with the fellows from Duke, okay? So if you need primary care, if you need pharmacy delivery, if you need to have some blood drawn, whatever the case may be, please check in with the clinic because there are many things they can help you with. We do have Epic Maestro that integrates with your Duke MyChart. If you're someone that needs a blood draw, we need to get that information out to Duke Lab for you. That is our lab. Then we can certainly do that, okay? And we will communicate with your primary care through Duke MyChart. I just said all that, okay? So we do provide annual wellness visits for residents. If you have an acute illness, so 2 things I'll say about this. Let's say that Dr. Little is your doctor. Dr. Little will be your doctor throughout your time at the Forest at Duke. If you had to go to the health center because you got your knee done, and she will be your doctor there. She will follow you there. She will follow you back home. If you had to be permanently in the health center, she's your doctor. So we do that with 2 facets of specialists here. Our doctor follows you throughout the continuum, and our social workers follow you throughout the continuum. The social workers follow the rule of thumb by your last name. A through K belongs to Jennifer King, and L through Z belongs to Carissa Van Zyl. She has a new last name, so I'm just practicing that. Formerly known as Carissa Campbell. So I just wanted to make you aware of that. There are a lot of you and a few of them, so they're making their way through meeting with residents. And just know that if you have a need, they are happy to help you, and they're sort of a catch-all. They can answer a lot of different questions and resource things for you. And they're located across from the clinic on the 2nd floor of the Terraces building. Is there anything I didn't say there? We do, and Karen will speak to this as well, we do file your Medicare for your physician visits in the clinic, and you may certainly have a copay for that. And that builds over time, over the year towards your deductible. But we do, in fact, bill your Part B for the physician visit, and you may have a copay. I think that's all. So the physicians at the Forest, we have 2 geriatric fellows, as well as Dr. Boer, who's our clinic medical director, and Dr. Little. We partner with the geriatric fellows at Crowsdale, where Dr. Heidi White is the medical director. They also have geriatric fellows there. And the entire division of geriatric takes the on-call for the Forest. So we have 24/7 on-call with our physicians, and if for some reason you're speaking to a fellow and something just doesn't seem quite right for you, we can always elevate that call to the attending that's on if we need to do that. So just to make you aware of that, there's a double layer there, okay? If you need an appointment to a specialist, and this is your doctor group, you want to talk to Laurie about getting a specialist referral. She's pretty magic with that. The specialists that are available on campus, our dentist suite still has some work to be done, so our dentist Studio G is not back on campus yet, but we're getting the special lighting and things that we need to do for that particular space. We knew that was going to need a little extra work. But we do have 2 audiology providers, and that is something you will see on our calendar, and you sign up for that. It is Duke Audiology, and I apologize, I never know the name of the other audiology group. They've changed their name a couple of times. So does anybody know the other audiologist's name? I'm sorry, I just don't know that. They've been coming here for decades. We do have Jennifer, and Jennifer Champion. She is a podiatry specialist RN, and she comes to the Forest at least three times a month. That has been a great service. She can come to you, or you can go to a specified place in the clinic to have that service provided, but she's been a great addition to our group. Psychiatry, we do have a psychiatry group and contract with them. And if that is something that is needed, then that will be worked through the clinic for you to make a referral, whether it be for talk therapy, if you have adjustments to medications, antipsychotics, any of those things that have been long-term usage for you, they can certainly be helpful for that. But we will certainly help you get a referral to the psychiatry group if necessary, and they also work in the health center. Ophthalmology, Dr. Newman will come here on a Friday if we have a group of people. He's on Irwin Road. Most folks in independent living, if they're looking for an ophthalmologist because they're new to the area, I wish you well if you are able to get into the Duke Eye Center. But they're wonderful if you can get an appointment. So just know Dr. Newman tries to help the Forest out any way he can, and he's wonderful in the health center. We take glasses over there to him, and he screws them all back together and really takes care of us in a great way. Dietary, we do have a registered dietitian on campus. That is Shannon O'Coin, and her office space is in the health center, but you can certainly have a referral to the registered dietitian, and that would be done through the clinic or through your physician. Pharmacy services. Please speak with Laurie if you'd like to talk about one of our pharmacies delivering to the clinic with your medications. That can happen. She sets that up for you, lets you know who to reach out to set up your billing and what that service looks like. That became obviously very popular during COVID, and many people kept that service. So just know that that has been a service that's been very helpful. Billing. So I just said this. Your visits to the clinic are filed to your Medicare provider, and there you may be responsible for a copay that goes through to your annual deductible. So transitioning through the continuum, if you know about one transition, you only know about one transition, okay? They're all different. But go ahead and dispel the myth so it is passed on correctly. We do not come under the cover of darkness and grab you out of your apartment and take you to the health center, okay? Because what you have to know, if you've read any of the details about the Forest, we have 90 beds. And y'all are like, I don't know, what, 500 strong at this point? It's getting there, okay? So I can't have all of you. But the point of all of that is, that's just the little humorous part. That I used to get accused of that when I was a social worker. You rode the golf cart 3 a.m. No, I was in the bed. I was sleeping. But just know there are emergency things that happen. Someone may need to go to the hospital, then come back to the health center because they need to have some attendance to them to transition back home, okay? So that's the quick one, all right, that happens. It's acute. It's an acute incident, and you may need to go to the health center. You may then be sent to the hospital. It just depends on what's going on, okay? The longer-term thing that happens, and the really important reason that the doctor and the social worker are involved with you from the beginning of you coming to the Forest is everybody's aging. I'm aging as I stand here. You're aging as you sit there. And I want you to enjoy everything that's fantastic here because this is a really fun place. But one of the reasons that you came to a continuum of care, such as the Forest at Duke, is that when you need help medically, personally, personal care, the health center is here. The nurses, the certified nursing assistants, the dining care partners, the housekeeping care partners, the activities care partners. I could go on and on and on. Based on the small house model of care, those are all of the people that are available to assist you. But this is hard. It is very difficult. So the idea that, let's just say Jennifer King works with you from the very beginning, maybe you're learning about living in the Durham area, and you all develop a relationship, and she meets your children, and you get COVID, and she brings you your mail. I mean, there are all these ways that you can be involved with the social workers, and then something happens to your memory, okay? Something happens to your memory, and there are several things that we have to take into consideration. Are you safe? And then everyone says in their head, how can you gauge if someone's safe or not? I can gauge that someone's safe or not by a multitude of things. We work with the physicians, we work with the social workers, we work with the therapist, because can you get out of your home if there's a fire safely? Do you not, are you able to physically? And do you have the insight and judgment to do that? Okay. One of the other things is medications, when you have no cognitive problems whatsoever, are complicated. I've done my parents' medications. I've helped people with medications here. It is difficult, okay? It's very important, everybody has their system of how to take their medications. When cognition begins to play a factor, there are a couple of things in terms of executive function that may disappear, be hindered, or not as astute as they used to be. Checkbooks become hard. Not able to do your taxes becomes hard. Managing your medication becomes more difficult. So there's this whole, there's not a special list. There's not a special clock you're going to draw. None of those things are going to happen. You have a relationship with your doctor, and you have a relationship with your social worker, and along the way a therapist, and those people are going to raise their hand, or nurse in the clinic, and say, we're concerned about Cindy Lou Who. We're worried about her. And so we begin a process with you. Maybe it's just having some support in your home. Maybe it is just having a few hours from the forest at home to help you in the morning, or to have some med management, that type of thing. That's the reason the forest at home is here. Because just because you're changing doesn't mean you go zip over to the health center. That's not the way that goes. Again, there are 90 beds there, okay? So we have done, in my career here, and prior to that, a fantastic job of utilization with bed usage. That's not glamorous language, but that's what it's called. And I feel very certain that we will be fine to take care of those that need something. But I will tell you, I ask you that you get to know the team that's working with you and trust those people to do exactly what you have signed a contract to do, and that is to be objective about what is safe and what is dignified and what can be a respectful course of your life care plan. Okay? So those relationships are very important. But that's the continuum. There are more educational series. I could talk about the continuum and transitions until tomorrow, but I'm not going to. Other people have to do things like Karen and Jessica. So please know that we have additional series. There's a series of 4 where we talk about transitions, and the team is here, and we do all of that. But you can always talk to me. You can talk to the social workers. You can talk to your physician. This is a community of transition. This is not an age-in-place community. As far as care is concerned in your home, we have a guideline that you should not need more than 4 hours of personal care in your home. That's very different than somebody's going to the store for you, or ironing the linens, or whatever the case may be. I'm talking about personal care. I'm not talking about assistance. So just know there's a distinction with that. 24-hour care in an independent living space is only allowed if someone is in hospice care, and there has to be a primary caregiver there with them. You have to have a plan. There has to be a primary caregiver there. And then hospice, of course, is in and out. Many of you know about hospice, but that is not someone that comes in and stays with you, okay? They consult on your care. They make sure you have a comfort kit. They're fantastic. Love, love, love hospice. We have 3 contracts. We have Transitions, Life Care. We have Duke Hospice, and we have Liberty Hospice, though they've only participated one time in a case here. But we do want to make sure people have choices. Great relationships there. But please know, ask questions. You may be going home from having a knee replacement, and you need somebody at night with you for 8 hours for a week. That's fine. You're titrating that back the whole time, okay? We're very reasonable people, very reasonable, okay? Uh-oh. I did something wrong. Where did Emma go? I think I did everything, didn't I? Sorry. One of the things I want to say that I think is very important, I think I have about another minute and a half. Please don't sit in your independent living apartment or down at lunch or whatever and worry about what's going to happen if. Now, if I was magic, I'd go, psh, make sure that nobody did that. We do that, okay? Ask a question. There's so many experts here, so many experts. I've been doing this for 36 years. I've seen many things, and then I always get surprised. But what is so painful many times is what I call people suffering in silence. When you can just ask that question and know that we're going to do everything we can to answer that question. We can't forecast the future, but we can let you know how we'll be here for the future. So please just ask. Sometimes it's just hard to ask. Please ask. If you hear something that sounds strange, like that Leanne came and got me out of my apartment and I don't know why at 3 a.m., please ask me. I'll tell you I didn't do that. But just ask. The forest is very strong in community. But be a friend to yourself and be a friend to your cohorts. And if something doesn't sound right, please ask. I have my phone on 24 hours a day. Please don't call me all at once, but I'm happy to answer a question. And we are here for you. We are in place. I love that we're a single site entity because the CEO's right here on campus, the CFO's right here on campus. I'm right here on campus. We're not spread out in some corporate building somewhere going, gosh, I wonder what those people are doing over at the forest. Let's make a rule. I mean, that's not what we're doing. We're living in this space with you. So please ask a question. Settle your mind. It doesn't matter what the question is. Tell us about your families. Everybody has a point person. Everybody has a complication. Human behavior and families are my favorite thing, so that's really important, okay? So I think we need to take a couple of minutes for questions. And did you have a question? The lady in the lavender shirt? You did not. Okay, I thought you did. Yes, ma'am. Yes, ma'am.
What is the phone number where we can reach you?
Where you can reach who?
Where we can reach you.
Oh.
Phone number
For?
to reach you.
Oh. Okay. 919 616 8252. 8252.
I have a second, more complicated question. Are there any supports in place for people going? Are there any supports in place for people going to see their doctor, to go with them, to hear what the doctor has said, or to go with them in the clinic and to hear what the doctors here are saying? Because people here have hearing issues and perhaps some beginning memory issues. So my question is, are there any supports in place where somebody goes with someone? I have a partner. He's upstairs with something else. But many people here don't, and I don't know if I'm always going to have a partner.
Mm-hmm. So the question is, do we have a resource or a support here for someone going to their physician off campus or their physician on campus to go with them to hear what they are hearing so they can either help take notes or do a reminder or fill in the holes where information is concerned. My first recommendation would be that if you have local family or spouse, that should be your first go-to, okay? You know, I would have to talk to, I'm going to make an assumption here, but I'm going to confirm this for you. I'm going to find out if the nurse is in the room when you see the physician, because I think it makes sense that Karen would be that person. There's this whole confidentiality issue. If someone from the Forest at Home, for instance, goes with you, they don't have a need to know that information. So the physician also writes a note in your Duke My Chart that would be a really good reminder for you about what was discussed in the appointment. But I would say our first layer of that would have to be a family or a friend.
I'm a retired social worker. I'm new here. I'm here 7 days. But looking to the future, I would like to think that there might be volunteers here. I would go with you to your doctor appointment, and then you or somebody else come with me to do just what you're saying, to write the notes and to make sure that I heard everything that was said, how many times a day I'm supposed to do so.
Well, let me think about that. And if somebody can get her name for me.
I'm Judith Adler, 3101.
Okay. All right. I'm going to think about that. Next. Yes, ma'am. So the question is, when we bill insurance, do we bill Medicare as well as Medicare Advantage?
Yeah,
Is that it?
Yep.
Yes, ma'am, we do.
and a related question that I think applies to some of us here, if we have UNC physicians, do you link with UNC MyChart or only Duke MyChart?
The providers in the clinic have care everywhere, and they do in fact do that. Yes, ma'am. We have several people that go to UNC. Yes, sir, in the back. Karen's the best person to answer that.
We, as the Forest at Duke, has a closed, the question was, if you have a Medicare Advantage plan, do we bill that? Well, everyone's insurance is different, and Medicare Advantage plans are all with different insurance companies. So the Forest at Duke, as a provider, we are not in network with any Medicare Advantage plan except the Blue Care HMO, the Blue Care plans. So you would be out of network. And anyone that is in a Medicare Advantage plan, that would have to be pre-authorized just like at any other institution. We still bill your insurance, but everyone's is different. It's going to depend on your personal insurance that you have.
Just a follow-up question. So, for example, we're in a Aetna Medicare Advantage plan, which Duke physicians are now participating providers, but we happen to have an out-of-network benefit under our Part C, so we'd have to pay the out-of-network rate?
We have to remember that, and that's the little worksheet that I gave you all there is, Leanne does a really great job of explaining all of the healthcare services that you have here at the Forest at Duke, which are many, 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 and are so convenient for you. However, people are wondering, well, how come I got a bill from Legacy Therapy? And they'd ask me in accounting, and I said, well, I don't know. I didn't know that you went to see the therapist. Because what's really important to remember, and what I tried to do with that little chart that you have there, is put in one place of all the services that we have at the Forest at Duke. People want to know, well, how am I going to get billed for that and who's going to pay? And where that really depends on is first you have to consider what is the type of service that you're getting, where are you receiving that service, but most importantly, who is providing that service? Because who provides it is the one that's going to bill it. And that is going to determine whether it's under your insurance or whether it is not. So Whether or not Duke does what they do is not us. If a provider is here, the forest at Duke is the provider. So the physicians here are not billing under Duke. They're providing the service here under the forest at Duke. So we bill that, those services that you receive if you're on a Medicare stay in our health center. Those will be billed if you are a qualified person that you will receive the care in the skilled nursing facility. Those will be billed under your Part A benefits or under your Medicare Advantage plan. And so that's all insurance related. If you go to the clinic and get physician services, those are provided by the practitioners here at the Forest at Duke, but they're billed under the Forest at Duke. We bill your Medicare Part B and your supplement, and then if you have an Advantage plan, that works the same way. But if you are staying in the Health and Wellness Center permanently, and that's where you live, a lot of residents will say, well, then how does my long-term care insurance work? Long-term care insurance is for convalescent care where you live. So those type of bills that I was talking about, when we're billing your insurance, you're not going to see any of that unless you have a copay. And if there is a copay, you might get that on your bill that we send in the accounting department. And it will have, if you had a patient responsibility, you get that explanation of benefits with your bill, and that's going to explain why you were billed $20 or $30.50, whatever that may be. It's all different. Every resident's insurance is different. But if you live in the Health and Wellness Center, that's private pay. So you will see that on your monthly bill, whether you live in the assisted living rooms or if you're in skilled nursing, and that's private pay. And you may, if you have long-term care insurance, you may be utilize your benefits for that. So that's in a nutshell how that grid is working that I passed out to you, just to explain where am I, because you also may go to the podiatrist. So who's providing that service? The podiatrist, right? So the podiatrist is going to be billing you. Or if you go to the dentist, you can have that here, which is awesome. You don't have to go anywhere. But the dentist is going to be utilizing, some may have a dental plan, some may not. So he is going to be billing you their place and utilizing your insurance or not. So I know you have a lot of the tours where you really want to go. So that's really what I wanted to explain with that worksheet that you can take with you. But that's really how you need to think about it and how it will be paid for. More questions? I did, I already talked.
Oh, you did that
Pretty
one?
much, yeah,
Oh,
pretty
okay.
much. Yes,
So Forest of Duke as an institution isn't in plan with any Part C carrier.
that is correct. The Forest at Duke participates with Medicare Part A and Medicare Part B.
But not C.
But for the Advantage plans, the best thing to do is if you have any questions about your insurance, is to make an appointment with Kasia Charles, who is our billing specialist. I wish it was easy. Insurance is not. You could have a Blue Cross plan, you have a Blue Cross plan, and you have a Blue Cross plan, and they're all different. I wish it was easier. It's not. It depends. But we are in network for a few of the Advantage plans, and that would be with Blue Cross.
So just to explain the reason why we aren't in network is that the Advantage plans don't like us because we only have 4 Medicare beds. Their business model negotiates the cost of care with people that have, 75 beds, that have 15 beds, that have 12. We have 4 beds, and there are times that those beds are empty. There's no way they can negotiate. Our business is too small for them to negotiate a rate with us because Karen's tried.
The most important thing is, as I said, we are a closed certificate of need. So whenever a nursing home that's a standalone nursing home, a hospital, a CCRC, before you even build your facility, you have to petition and file this big, huge old form with the county to say how many beds are you going to have, and whether those are going to be closed or open. Open beds are ones that are open to the entire community. So when you go to the hospital and you may be able to be discharged to a skilled nursing facility to recuperate, they fax all of the skilled nursing facilities in the county to see if you will be admitted. We can't have any of those faxes because we're closed. The only people that can come to our skilled nursing facility is you. So we can't be in the network because we can't be in a book, right? Remember when you were at work and you would go through the book to see like who is in the network? And that's how Advantage plans work. They're in network or out of network, and we are not in anyone's network. And we just were fortunate to get with Blue Cross just because of the long-time relationship that we've had with them, with our clinics since the beginning. Other questions?
So the question is, if I have a future medical appointment and I'm in the Duke network and my doctor has ordered lab work, can I get that drawn here? Can I get that sent to Duke Lab here? The answer is yes. So you would want to call Laurie at 4020, that's the clinic. Let her know what you need. She can see it in Duke MyChart, and she will schedule for you to come in and have the blood drawn done, and the blood will be drawn and sent to Duke Lab, and then your physician can see it. Next question? Yes, ma'am. No, ma'am. We do not currently have AEDs on our property. That is something that is in conversation with our medical director. And no, we do not have any on campus, period. What would happen is if you were a full code and you needed to have CPR, then of course the nurse would initiate that. Okay? All right, yes, ma'am. Right. So you should go by security, which is right here down the hall, and have your pendant with you and test it with them. That's what they ask that everyone does. I wouldn't go like all of you immediately after this, or you'll be waiting a while. But go by security, test your pendant, and do that with security, and they're happy to do that for you. Yes,
So
sir.
I understand the point about why in-network doesn't make sense because we're closed. But we were told that Humana was in-network. Is that not accurate?
So the question
The
is,
state Humana, the state employees Humana.
so the question is, he was told that we're in network for state Humana, and I'm going to let Karen answer that. I'm not sure who shared that.
I would go see Kasia Charles to verify and make sure, because they change all of the time, and she does the billing for that. So I don't want to give you the wrong answer.
Yes, ma'am. Well, what I ask is if you've already been to the health center and you're familiar with the health center, please don't go on the tour today. We are going to do the tour for as many people that want to go today. If you don't want to go with a larger group, then you'll call your social worker and ask for a tour. Other questions? Okay, so everyone that's going on the tour, if you could move to this side of the room. If you're not going over on the tour, it was good to see you.